Hi, Zikhona, how are you?
I'm good, Ito. How are you?
I'm good, thank you very much. So Zikhona, can you tell us a little bit about yourself? Who is Zikhona? Where do you live? Things like that.
All right. My name is Zikhona Fundama. I was born and raised in Mount Aleph, a small town in the Eastern Cape. I'm currently staying in Pretoria, where I'm working as a medical intern at Steve Biko Academic Hospital. So that means I'm a practicing doctor after completing my degree for 6 years in Walter Sisulu University, which is also in the Eastern Cape. Yeah.
Awesome, fantastic. That sounds interesting. So, how long were you in the Eastern Cape before you moved to Pretoria?
So I've been in Eastern Cape literally all my life.
Okay.
And I even went to study. I studied in Eastern Cape
Wow.
from primary to high school and even tertiary. So that's why I studied in Walter Sisulu University, which is located in Eastern Cape as well. I studied medicine, Bachelor of Medicine, which is 6 years. Yeah.
Sure. So after your 6 years, you came through to Pretoria to do your internship.
Yes. So how it works is that you complete the degree, which takes 6 years, and then afterwards you do internship, which is 2 years, and then community service, which is a year. So you do community service after the 2 years of internship, and then afterwards you can choose what you want to do. You can branch into the private sector, become a general practitioner, run your own business, or you can continue in the public sector, and if you want to specialize, then you have to study further again. So I'm currently doing the second year of my internship here.
Awesome. So at what point do we start calling you Dr. Zikhona? Like from the time you graduated or from now?
From the time I graduated, because that certificate is what qualifies me for you guys to call me Dr. Zikhona Fundama.
Okay, so my apologies, Dr. Zikhona.
No, no, it's fine. Fine at all.
Awesome, awesome. And I'm sure the family must be very proud of you. I mean, medicine is quite a difficult qualification. And for you to have gone through the 6 year journey, did you fund yourself or family funded you, or how did you get funding for your studies?
So, yes, medicine is quite a big and challenging course to do, and I would say even difficult. But I had a great support from my family. However, they were not able to fund for my studies, and I had to get a bursary through the Walter Sisulu finance department. There was a lady there who helped us to apply for bursaries, and therefore, when I got my bursary, they paid for the whole 6 years.
Oh, that's fantastic. Sure, that's fantastic. So, as a child, is that always been your dream qualification? So, you always wanted to be a doctor, or when did you have this desire to become a doctor?
So actually, turns out that I've wanted to be a doctor ever since I was little, because I remember when I was 7 years of age at school, there was a career day. I think we had to dress up as the professions in which we want to work when we're older, and therefore I was dressed as a doctor. So
Oh, wow.
actually always thought about it. I'm not even sure where or how I thought about it, because I hadn't known that there was anyone who was actually a doctor, a qualified doctor, at home, or let alone in the community. But later on, when I was doing high school, I found out that one of my uncles is actually a doctor.
Oh, wow.
So yeah, I don't know. But yeah, by the time I had to apply, even in grade 12, I was sure I wanted to do medicine. I wanted to be a doctor. For me, it was just the most interesting job that a person could do. Because I remember I did try studying business studies when I was in grade 10.
Yeah.
But 3 months later, I realized that no, I do not want to be in the commercial side, in the commercial sector, and I changed that to life sciences, and I was able to apply to the course, the medicine course, with the life sciences, physical sciences, mathematics, and therefore, yeah,
Sure.
I went back.
Yeah, that sounds fantastic. I mean, I think of my days. I wanted to become a medical doctor at some point. Um,
Really?
yeah, so I never actually studied medicine. I started with Bachelor of Pharmacy in my first year, and then we went to visit a hospital where they had a museum in there, and it completely freaked me out. And then I changed course, went to science. I didn't have the guts for medicine. So
Oh my
kudos to
goodness.
you.
So what I actually did when I started my first year of medicine, because it's two different things when someone is telling you about their journey and for you to experience it yourself. So when I was doing my first year of medicine, what I decided to do in order to see whether or not I would be fit enough to work in the field, I went to the local hospital, which is Mount Aleph Hospital. It's next to home. I went there and I followed one of the doctors and I asked questions and I looked at what they had to be doing day to day. I went there, I think, for about a week. And yeah, I decided actually, yeah, this is it.
This is for me.
I can do this, in the next coming years and probably for the rest of my life, So that gave me some exposure and a good practical idea of what I'm going to be doing. And yeah, I never looked back.
That's amazing. You were more prepared than I ever was.
Yes, definitely.
Yeah. And then, so tell us a little bit about it. I mean, medicine is very interesting, especially in the times that we're in now. So give us a sense. What does your internship look like? What kind of things do you do in the hospital? Do you get to deal with patients? What sort of work are you doing in the hospital?
Okay. So I should just mention that in our medical medicine course in Walter Sisulu University, from fourth year, when you're studying your fourth year of medicine, we start going to the hospital. That means that we start interacting with the patients at that time, and even our examinations, we are being tested in front of a patient after examining a patient and all that. But now afterwards, in internship, what happens is that it's 2 years, so it's 24 months. And what happens is that we rotate through 8 different departments. So in each department, we rotate there for 4 months. So the 8 departments is the obstetrics and gynecology. There is general surgery. There is internal medicine. There is orthopedics, anesthesia, pediatrics, as well as family medicine and psychiatry. So the point is that we need to be exposed as qualified doctors to the different types of patients that we're going to encounter, in our practice in the field. So from babies, like newborn babies, to
Sure.
toddlers, to teenagers, to pregnant mothers, and to people who want to become pregnant, to the elderly, elderly women and men who are suffering from the common conditions, the diabetes, high blood pressure. And also we are exposed to people with mental illnesses. We spend a whole month in that ward, seeing and treating or helping to treat people who also suffer from mental illness, because that on its own is also an illness that needs to be treated by us as well. But now the nice thing about internship is that during these 2 years, because we just came out of medical school, we are under supervision. So we have our seniors present at all times who show us the ropes, basically. Therefore,
Yeah.
we make sure that we do everything correctly. We protect ourselves as well as the patients whilst we are treating or managing them.
Sure. Wow. It sounds like an amazing thing. And then in that 2 years, then do you then choose which field you want to specialize if you want to specialize, or you choose which field you want to remain general if you want to practice general medicine?
Yes, so it's quite sufficient time, I guess, 4 months is quite a long time spending in one place. So yes, one is exposed enough to decide where they want to go, if they want to specialize. So we don't necessarily have to, like I said, after this 2 years of internship, I have to do my community service next year. And then afterwards, then if I'm sure of what I want to specialize into, or if I'm sure that I do want to specialize, then I can go further and do that.
Okay, fantastic. And then in terms of your community service, are you still going to do it within Pretoria, or are you thinking of going back home?
So like I explained, I'm a bursary holder and they helped me a lot. But now the terms or the conditions was that after I've completed my internship, I must go back to the Eastern Cape and serve the province for the number of years that they funded me. So next year, or rather this year ending, I have to move back to Eastern Cape again.
Sure. And are you looking forward to that? I mean, in comparison to where you are at now, do you think you'll be able to still add as much value as you've been doing here from a resource perspective?
I don't know. I mean, I knew this was going to happen. So
Yeah.
for me, I just wanted to come to another province because I've never been in any other province. Most of my life has been in Eastern Cape. So I just wanted to be exposed to a different type of environment, especially the hospital. You know, I'm coming from, this is a tertiary institution where I'm in, you know, I'm exposed to a lot of things. There are a lot of resources as well. So I know and I've heard, but I also know as a medical student that back in Eastern Cape, we don't have a lot of resources. And unfortunately, we are primarily supposed to be working in the district hospitals, which even have less resources. But it's something that I have to do, you know, to show my gratitude for them funding me for all these years. And really, no one volunteers to go there. Therefore, we have to go because we are the bursary holders, you know. So it's our way of paying back or giving back to the province.
Yeah. And I think I'm sure a lot of people, the young people that you grew up with, those that you went to school with, they definitely want to see Dr. Zikhona servicing them in their
Yes.
hospital. So I'm sure it's a great opportunity as
Sorry.
well. So I was just saying, I'm sure it's a great opportunity as well for you to also serve your community.
Yes. So when I went home last year, this year during my leave, everyone is surprised to know that I'm already working as a doctor. And they'll ask me, but where are you working? Like which hospital? Like they want to come there and all that. No, and I just tell them I'm in Pretoria, so I know no one's gonna come to Pretoria. But yes, I'm definitely looking forward to going back because even for my parents, this has been a bit far for them to travel. They actually haven't come this side, and this pandemic didn't help as well with
Yeah.
us not being allowed to travel inter-provincially. But yes, it's actually interesting that in high school, when we started applying for going into tertiary. There was actually 7 of us in my class who were interested in doing medicine, and out of the 7, I'm the only one who actually did. So I mean, yeah, I'm ready, and I'm happy to go back to them and just tell them about my journey for those who are interested in doing medicine still, because it's never too late, really. Even when I was still doing my second and third year, you know, we had people who were older than us who have other qualifications, but they were still interested in doing medicine. And they finished with us and are working right now, you know, in other provinces as qualified doctors. So 6 years seems like a long time, but it actually isn't. If you're determined to do it and you're sure about it, you know, it goes so fast. I mean, even now, I can't believe I'm already completing my second year of internship, you know, so it's amazing, honestly.
Sure, it's a very inspiring story, and I think you raised a very important point, which is medicine is actually difficult to get into from a university perspective. And maybe share a little bit on you having been successful. What were some of the things that you did to help you get into the qualification?
Okay. So the thing is that there are a lot of institutions that offer medicine in South Africa. However, they have different criteria for admission into the course. Wits, for example, and University of Witwatersrand and University of Pretoria, as well as University of Cape Town. They have the APS scoring system, which
Yeah,
means that they calculate the number of points that you get. When the certificate, the matric certificate, besides the grading, the percentage, you also get the levels,
yeah,
and that's how their criteria for admission is structured. Therefore, you need at least minimum. This is minimum. The important word is minimum of level fives for physical sciences, mathematics, life sciences, as well as English.
yeah.
So I had level fives for
Oh,
all these modules, including the rest, which is life orientation. I did consumer studies as well. But now the point is that you need to apply to as many as you can, but obviously you need to have your first choice, the place that you really want to go to. So
yeah,
for me, I actually wanted to study in University of Pretoria, but they also need you to apply whilst you're doing your grade 11. So they want to see your academic record from grade 11 onwards. So unfortunately for me, with my grade 11 final results, I did not meet their criteria to study medicine. And they already send you a feedback already in the first term, I think it was in grade 12, that I did not meet the criteria, of which I was very sad about that because I was looking forward to coming to study the side. But then in Walter Sisulu University, I met the criteria, and that's how I was accepted to study medicine there.
sure. That's awesome, and I think reflecting back, that's one thing I didn't do when I was applying. So I only set my head to go to Wits or UCT. So I only
Oh,
applied to those two, and then got into Bachelor of Pharmacy at Wits, and then they told me no, the first year is the same, so you can start there anyway. And then yeah, I was shocked in my first year, and then ran away.
yeah. Yeah, the point is throw a lot of stones. Hoping more
Yeah.
than one packet, but for me, Walter Sisulu was, the one that actually accepted me, and I was happy about that. However, as everyone knows, that there are protests that happen in Walter Sisulu University during study years, but because no one usually wants to go there as their first choice because of that. But I realized that since there was no other institution that would offer me what I wanted to study, I was going to go there to Walter Sisulu University and stay focused, and the big picture. You just need to think about the big picture, that after all of this has passed, where will I be? Where will I go with this certificate? Because it is the same certificate that my other colleagues were getting in University of Pretoria and University of Cape Town. And, as evidenced by me being here amongst them, that I was not at a disadvantage just because I went to Walter Sisulu University.
Yeah.
Because, like I said, 6 years seems like a long time, of which it can be. But now the downside is if something happens, you lose focus, and you happen to repeat a module. And for medicine, if you fail one module, then you have to repeat the whole year, of
Yeah.
which that delays you even further. So I just decided I'm going to go there, do my 6 years, and be done. And here I am now.
Wow. Congratulations for completing it. I
Thank
think
you.
it's absolutely awesome.
Thank you.
So let's jump more into your day-to-day activities in the hospital. Just give us a sense. What does that look like? How many hours are you working? Things like that.
So in general, we have the normal working hours, which is 8 to 4, like everyone else. But what is different with us is that we also have what is called overtime working hours. So with that, we have usually calls, which are 24 hours. So they can be during the week or during the weekend, where you literally have to be in the hospital premises from 8 o'clock to the next morning at 8 o'clock.
Yo, my goodness. Sure. And how do you get by? How do you get through that?
It's really something I was anxious about coming from medical school because in WUSU, or Walter Sisulu University, we did not do that as students, the 24-hour calls. We did minimum of 6-hour calls, but we were helping out in the emergency unit whilst we were there during the day, you know. But yes, it's a lot, you know, if you think about it. It's
Sounds
a
very.
whole day that you're supposed to spend awake, you know. But there's really no other method but for you to just be mentally prepared for it, you know. You have to bring enough food, snacks, you know, as well as coffee. Coffee helps a lot to stay awake. But usually it differs. It's not that bad because it always depends on the number of people or patients who come in at night. So you'd find that in some nights you have it's going to be busy from 8 o'clock in the morning until 6 p.m. And for the rest of the night, you have two people coming in a minimum of 4 to 6 hours, you know, and at midnight, you usually get time to rest for about 3 to 4 hours. But then by the morning, you're up again, you know. So, how it usually happens is that it depends on which department you're in. So, for example, I'm currently in family medicine.
Uh,
So what my day looks like is that I'm currently in OPD, outpatients department. So I go to work at 8 until 4 p.m. So we see the patients who have chronic illnesses. For example, most have diabetes, high blood pressure, as well as HIV. So we just see them at the clinic. We renew their scripts. If they have any new problems, then we treat whatever problem they're presenting with then, or we refer them. So family medicine, the Department of Family Medicine is actually in the Tshwane District Hospital, which is very like it's neighboring Steve Biko Academic Hospital. So if the patient is presenting with a new problem, then we refer to Steve Biko Hospital for further management or specialty consultation. And also now that there's a pandemic here in Gauteng for our unit, they've actually made or decided to make the Tshwane District Hospital the admitting hospital for positive corona patients. So every patient that we meet in the clinic, we have to send to Stivigo because the district hospital is not functioning as a hospital anymore because it's only admitting the positive cases of corona.
sure. And I mean, you're touching on an interesting point on what our country is facing now. And a lot of us are very curious in terms of what's the experience like in the hospital. I think for people that don't believe corona is there, what's it like when you see those patients and some of that?
To be honest, I've heard this question a lot. You know, I don't know. People think or assume that people with corona look differently.
Yeah.
But to be honest, from my perspective, there are people who actually have, because as you know, there are asymptomatic people and as well as symptomatic people. So for us, there isn't really a huge difference in the patients that you see. And for me in general, there hasn't been, a drastic difference. It's just the fact that now there are tents. We have tents outside the hospital where we screen the patients first, and obviously if they are symptomatic, for example, shortness of breath is the most common symptom that they usually present with, and fever. They may also have chest pain, loss of appetite, vomiting, or diarrhea, but usually they're presenting with shortness of breath. And these patients, you don't usually spot them out. It's not a different symptom to what we are usually used to. It's just normal patients, and we become suspicious if they have shortness of breath because there's a pandemic that is going on. So we screen them first, and then depending on their vitals and their state, their general state, if they are stable or not, then we admit, or we send them, we refer them to their local clinics to get tested. And yeah, so there's actually quite a few of patients in the hospital currently, well, in the tents, like I said. So what happens is that if they're symptomatic and they are not stable enough to go home, then we test them. So there's a swab that is done to test for the corona. But while they wait for the results, they have to be in the tent. And then if they test positive, then they are transferred or transported by the ambulance to the district hospital, which is next door to us. But the I don't know if it's frustrating thing about this virus is that it does not look different. You will not see, like, the person who is infected will not look different to another person who just has shortness of breath because maybe they have heart failure or anything like that. But it is real. It is definitely real.
Thank you for
So the
confirming
other
that.
difference is that we have to be cautious to protect ourselves. So if you have to swab the person, but even during the screening, it is done outside. It is not in a confined space. But we are all wearing masks, we are wearing gloves, and then when you want to or have to swab the patient, then you have to be dressed in the PPE as well to do that because you need to be protected because we do not know who's going to test positive and who's going to test negative. So we have to take precautions. So that's the big difference. And it's actually quite uncomfortable to work dressed in that
That
because
was my next question.
it's a lot of layers.
Sure, I can imagine. And it must be uncomfortable to work in such a difficult environment as well.
It is.
Sure.
Yeah, so I was about to mention that as amazing as this job has been, is that we none of us expected that only during the second year working we'd be faced with, it's really it's never happened before, and it's quite a scary thing if we do not know about it, if you're not aware of it. But we're getting used to it because we are the essential workers.
Definitely. And we really appreciate that because, I mean, we take for granted the effort that you wake up in the morning and you go out there and face the pandemic head on. And in most instances, like you say, I mean, the protective layers are not comfortable. We had seen horrible pictures of doctors developing weird things on their faces because of the equipment they're using, which is quite scary. And we commend you for that. It's really amazing.
Thank you.
And I must say, so being a young person in such a situation, I mean, generally medicine is a glamorous role. People respect you in the community. They love the work that you do. I'm sure there's people that probably call you for scripts now and then.
Yes.
What are some of the challenges that you are facing as a young doctor in South Africa, just outside of the pandemic?
Well, it's true. There's a lot of expectations. by people in the community outside of the hospital. If everyone has this idea that, oh, but you're a doctor, you're my friend, I must, yes, scripts are usually the most common thing. Just write a script for this. And sick notes. Hi, Doc. You get phone calls from your friends, hi, Doc, I'm not feeling well. Can you please write me a sick note? Things like that. But the funniest thing was when I went home this year in March, that was before the lockdown started. One of the elderly women in the family, when they saw me, they asked me for pills. I'm like, no, doctor, you must bring back pills for me. I'm not well. I'm like, no, I do not. I'm never like with pills, even in the workplace, you prescribe and then they go with the script to the pharmacy. I don't personally, take from my desk or whatever to give to them. So yeah, there are quite a lot of expectations, and sometimes randomly a person will call you, hey, what's wrong with me? I'm coughing, what's wrong with me? So yeah, I have to explain, and yeah, because you have to explain because most people do not understand. It's the same as when people expected me to be working in the local hospital, in Mount Elizabeth Hospital, and they want to go there to be treated by me. It does not work like that, but they don't know. So you have to explain because in their mind, if I'm working there and they come there, I just have to make things happen, that they come and they'll be seen by me only and all that. And that's not how it works. Even the CEO of that hospital, I will be having to manage the hospital. I will not be available, for day-to-day things for me to come there and, treat every family member who comes. And most of them will probably not be sick, but they just want to be seen by me, and they all, because the my surname is very common in Mount Aleph. There's a lot of relatives who share the surname Fundama. So, everyone will come and say, no, Fundama, call Dr. Fundama. My name is, Fundama,
We are related.
as sweet as they are, because it comes from a place of being proud of me, and they want to be recognized, that they are related to me and how proud they are of me and all that. But they do not know, so I have to explain, to them how it usually works.
Shame. I feel like you're probably on a 24-hour call more often than you know.
But I tell them when I'm at home, I tell them, now I am not on call. My presence here means I am not working. I've left work behind. So here I am just a daughter, I'm just a cousin, a nephew, basically.
Yeah. And maybe just as a final thought, I wanted to ask you, tell us a little bit about some of your ambitions beyond once you're done with community service. What did you like to do for yourself? Where would you like to see yourself, say, 5 years from now?
Sure. That's a tough one. Because I've realized during my second year now, I've realized that medicine is quite broad. There's a lot one can do after completing medicine, and I find myself a bit, undecided and confused because I don't want to choose one thing and then whilst I'm doing that, I want to do something else. So for now, I'm just still taking time. And one thing I want to make sure is that I still give myself enough exposure to the different departments even next year. I'm hoping that I go to a facility that still has these different departments so that I can still decide because the thing about deciding what you want to do is that you're probably going to be doing it for the rest of your life. And when
True.
I think about it, the rest of my life is probably 30 years, which is a lot. So I want to be sure, and for now, I haven't decided actually.
Okay. No, that's it, and it makes sense. I mean, like you say, you see quite a lot. You get excited by a couple of things, and then
Yeah.
certain things change over time. So it kind of makes sense to take it all in, and then once you're ready, you'll choose one and run with it. And any final advice, thoughts for young people listening and saying, I'm really inspired. I want to become a doctor myself, or no, maybe I'm scared. What encouragement would you give them?
So I would say, it's possible for a black child to be successful,
True.
to have a career in medicine, So it's important for one to be focused, to be sure as well, because once you have decided, you need to commit to
Mhm.
6 years. 6 years is a long time, but if you're committed and you're focused and you want it, you're passionate about it, then you're going to finish it in 6 years. And then the rest of your life begins after that. And also, people must not be discouraged by the fact that they don't have money at home to go into a tertiary institution. Because I myself had both my parents working, but there's two of us at home. And therefore, the fees are actually, it's a lot. When
Yes.
I was in my first year, that was in 2013, for tuition alone, you'd pay a minimum of 60,000 rand a year to study medicine. So it's a lot of money,
Yeah.
But they must not be discouraged. There are financial aids available in the tertiary institutions that fund, everyone. There's no criteria of selection, or exclusion. You apply and you get it because the terms are only that. The terms and conditions are only that you must come back and work in the province for
Yeah.
6 years. So, yes, it's possible, proof of that, even studying in Walter Sisulu University or anywhere else for that matter. But it's important to work hard, to study. You have to study really thick, thick every year. They don't get less, they get like way, way, way more. It's a lot of books, but, discipline, it helps
Yeah.
to be disciplined, but it comes from knowing what you want and focusing on the big picture. After this is what I want to do. You want to, because also the good thing about studying medicine, immediately after you're finished, you will be in the workplace. You will get a job immediately, and you will never be without a job. We apply, we get into the internship training program, and after that, we're applying again to go into the community service program. So you're guaranteed to get a job afterwards. You're guaranteed to get a salary afterwards.
Yeah.
So everyone is scared about the 6 years because they're like, oh, it's close to a decade and you're studying one thing. But focus on the big picture, then it's not a lot. And also, it's important to have support, either from your family or your friends or whoever, to just keep you encouraged, because it gets tough, as the years go further, the workload is more, and, you are faced with different types of conditions that you never knew existed, so it's important to have support, besides financially, emotional support and psychological support in order for you to make it to finish.
Well, thank you for that. And I think it's such a firstly, it's a good thing to see young Black women making it so much more than we used to in the past, and many, many more actually completing the qualification and practicing medicine. We need a lot of doctors in our country. Um,
Mhm.
I guess in the world globally, there's a
Yes,
big
especially now. Yes.
and I mean, we're grateful for the work you guys are doing because without you, our health is in shambles. So we need help to recoup ourselves, to get better and get back to what we do. And I'm very encouraged by the commitment and discipline you have in completing the course and staying the course. So thanks so much for your story. Thank you so much for your time, and we hope that people are encouraged listening to you, and those that are studying won't give up, and they'll continue pushing hard. 6 years, like you said, it seems long, but it's doable, and you
Yes.
completed it now. It's great. Thank you.
Thank you so much, Dwayne, for having me. I also hope that everyone will be encouraged by my message today. Thank you.
Awesome.